Hey, what's going on, guys? Welcome back to my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. If you're losing hair, visit my website at hairliciously.com for hair loss treatment solutions backed by science. Today's topic is extremely relevant for men who are taking medications like Finasteride or Dutasteride, commonly known as 5-alpha reductase inhibitors. These drugs, as we know, are best known to treating androgenic alopecia, but they're also widely used to manage benign prostatic hyperplasia, aka enlarged prostates. And because DHT is a key driver in both male pattern hair loss and also for enlarged prostates, using 5-alpha reductase inhibitors like Finasteride or Dutasteride is going to be key in lowering androgenic levels and managing both problems. So let's go and start with a bit of background. We know that Finasteride and Dutasteride work by blocking the enzyme 5-alpha reductase, which converts testosterone into DHT. And we know that DHT is a much more potent androgen than testosterone and any other endogenous androgens in the body that contributes to both prostate enlargement and hair follicle miniaturization. So if you think about it, it really makes sense that lowering DHT levels would help managing both enlarged prostates and also for treating hair loss. But what about prostate cancer? There are earlier studies out there that show that 5-alpha reductase inhibitors could reduce the incidence of low-grade prostate cancer, and that was great news. But on the flip side, they also appeared to increase the detection of higher-grade cancers, which led to years of uncertainty. So could 5-alpha reductase inhibitors be masking or even promoting more aggressive disease? This question has been literally hung over these medications for a long time. And I feel like there are people even to this day who are hesitant to use Finasteride or Dutasteride because of the potential risk of cancer. So this new study set out to answer a very specific question. If a man is already taking Finasteride or Dutasteride before being diagnosed with prostate cancer, is that going to improve or worsen his chances of survival? So to find out, researchers conducted a large population-based cohort study using data out in Ontario, Canada. And they looked at nearly 20,000 men, all aged 65 years or older, who were diagnosed with clinically localized prostate cancer between 2003 and 2017. And what makes this study so strong is actually the follow-up. The median tracking period was 9 years, which is excellent for analyzing long-term outcomes. And out of the nearly 20,000 men in the study, over 2,100 men had been using a 5-alpha reductase inhibitor, either Finasteride or Dutasteride, for at least 6 months before their prostate cancer diagnosis. The other 17,800 plus men had never used either of these drugs. And the researchers then compared two key outcomes: prostate cancer-specific mortality and overall mortality from any cause. Now, here's where it gets pretty interesting. At first glance, the raw numbers, which are the unadjusted data, actually showed a higher death rate among the men who were using 5-alpha reductase inhibitors. But remember, that's before controlling for important differences. Men who take 5-alpha reductase inhibitors are often older, have more comorbidities, and they have much more frequent doctor visits, which may skew the results. To address that, the researchers used a powerful statistical tool called inverse probability of treatment weighing. And this method basically balances the comparison groups, making them as similar as possible across dozens of variables like age, things like PSA level, tumor grade, and comorbidities. And once the data were adjusted, the results completely changed. There was no longer any significant difference in prostate cancer-specific mortality between the two groups. The hazard ratio was 1.02, meaning the risk was virtually identical between the groups. And similarly, there was no meaningful difference in overall mortality with a hazard ratio of 0.98. In other words, after balancing all the clinical and demographic factors, men who had been on 5-alpha reductase inhibitors like Finasteride or Dutasteride before their diagnosis were just as likely to survive as those who had never taken these medications. So what does that mean? It suggests that taking Finasteride or Dutasteride before being diagnosed with prostate cancer does not worsen your prognosis, and it might even help indirectly. There are a few biological reasons why this might be the case. First of all, if you're lowering DHT levels, 5-alpha reductase inhibitors may slow the growth of prostate tumors or make them less aggressive. DHT is a potent driver of prostate cell growth, so lowering DHT levels can reduce tumor aggressiveness. And secondly, the medications tend to shrink the prostate, which can make it easier to detect tumors during a biopsy. And third, men who are actually prescribed 5-alpha reductase inhibitors, especially for enlarged prostates, typically see their urologist more regularly for urologic evaluations, which may lead to earlier detection and treatment of prostate cancer. So even if the drug itself isn't directly improving survival, it may be a part of a bigger picture that leads to better outcomes. Now, there are also a few important strengths to highlight in the study. The sample size was pretty large, nearly 20,000 men. And honestly speaking, you really see a study size in this caliber, so that's pretty reassuring. The follow-up period was also pretty long at 9 years on average. And the researchers used robust statistical methods to adjust for a wide range of confounding factors. But like any study, there were some limitations. These were observational, not a randomized controlled trial. So we can't say for sure that 5-alpha reductase inhibitors caused neutral or positive outcomes. Also, the study only included men aged 65 and older, so we don't know if the same results would apply to younger men, especially those taking finasteride for hair loss rather than for prostate issues. And some important data like Gleason scores and detailed tumor biology were also missing in a small portion of the sample. And finally, lifestyle factors like smoking, alcohol, diet, physical activity weren't accounted for, which could influence survival outcomes. Still, I feel like this is one of the most comprehensive and rigorous studies to date examining the long-term safety of 5-alpha reductase inhibitors in the context of prostate cancer. And I feel like the takeaway is pretty clear. If you're currently taking finasteride or dutasteride, you can feel confident that you're not risking or increasing your risk of dying from prostate cancer or even getting prostate cancer. I feel like that's an incredibly important message, especially for men who are relying on medications not only for symptom relief but also for their quality of life and also for treating hair loss. So if you guys are watching this and you're using finasteride or dutasteride for treating hair loss, this study should offer some peace of mind. Of course, always talk to your doctor for specific risks, especially if you have a family history of prostate cancer or elevated PSA levels. But as of now, according to the study, the evidence says that you are on safe ground. So let me know what you guys think of the study and these findings. Were you concerned about the risks of cancer before? Did the study change your perspective? Drop your thoughts in the comments below. And if you found this video to be helpful, give it a thumbs up, give it a like, subscribe, and check out my other videos where I cover various topics pertaining to hair loss and hair transplants. Thanks for watching, guys, and I will talk to you guys in my next video. Take care.